Dr. Nima, thank you again for joining us here today with the Trinity Love Public Foundation. All right.
Here, I'm happy to do this.
Our goal again is to, spread the awareness about stroke.
Perfect. No, I appreciate it. Thank you very much for having me. Stroke is sudden loss of any brain function in the brain due to change in the blood vessel. And that is a stroke. And the stroke can be due to a blockage, a blood clot, like in the case of Debbie's, or it could be due to bleeding in the brain. The thing about the stroke is it causes disability because the brain cells die due to stroke. That leads to disability depending on where the brain damage happens. And therefore, stroke is number one cause of disability. There are treatments available for certain people with stroke, and our hope and our goal is through you and through education to raise awareness that stroke is number one cause of disability. It is an emergency. People should call 911 as soon as a stroke is noticed because there are treatments available. The problem, the treatments they're very time sensitive. So as soon as treatment can be offered, better outcome it is for the patient. So how do we recognize stroke? First, we need to know it's an emergency, but we have to be able to recognize it, right? So we use an acronym called FAST. Actually, what I like to use is BFAST. B, for example, stands for balance, because sometimes if somebody has all of a sudden balance problem, that could be a possible stroke. E stands for eyes. So if somebody cannot all of a sudden see, that could be a stroke. And then the FAST, which is a more known acronym for it, is as follows. The F stands for sudden weakness in one side of the face. So if all of a sudden you see somebody's face is droopy on one side, that is a sign of a stroke. A stands for arm weakness. So what do we do typically? We ask the patients, raise your arm up, like you're holding something. And if the arm is drooping or is not able to lift up one arm, that is a very indicative of a stroke. Then we have S. S is for speech. If somebody cannot speak correctly or having problem bringing the words out or whatnot, that could be a stroke. And then T is stands for time, because like we just said, time is very important. If the big picture here is, if you think of the brain, any part of the brain controls different part of the body. And you can see that the brain has all these blood vessels that go up to the brain. So if one of these blood vessels got blocked, depending on where the blockage is, that part of the brain is affected, then the body presents as to where the problem is. So the left side of the brain, for example, is in charge of speech and language, movement of the right arm and the leg. So if a blood clot, for example, go to the left side of the brain, those are the things that are going to be affected. The right side of the brain controls attention to the left, for example, movement of the left arm and leg. So stroke happens in one side of the body, affects one side of the brain, affects one side of the body. And this happens suddenly, right? This happens all of a sudden. That's really the sign and symptoms of stroke.
Thank you so much for joining us today, and for all you do for the Trinity Love Public Foundation as well. You and your team have been so wonderful, and we can thank you enough. And look forward to seeing you again next time. And I know you have an emergency and you have to go, and we thank you so much for your time.
Thanks again. My pleasure.